Never been to Victoria before. It's a small country town, a couple of hours north of Melbourne. So I didn't know what to expect. So I hadn't been on a plane or train or anything that much. So it was a big day of travelling for me, coming from North Queensland. It was kind of like our first placement. It was like being thrown in the deep end for me. So you got to see a lot of stuff which we hadn't been told about yet, and a lot of cool stuff as well. So, for example, like seeing a childbirth. I think on the second day I was here, just coming out of first year was an incredible experience. Yeah. Peter, the doctor I go with, is he's a general practitioner / anaesthetist. So it was kind of really getting a feel for rural general practice, which coming out of first year, didn't know what to expect.
I'm quite fortunate in that I've had experience in a metropolitan general practice and also in the rural practice now, and I really have the opportunity to compare and contrast the facilities available to them and also the opportunities that are available to interact with their patients. So in a rural practice you have a lot more sort of personal interaction and a lot more holistic care and continuing care of their patients, which I found, and a lot more sort of a social aspect too. So we've done quite a few home visits to patients who aren't able to make it to the practice, whether they're too old or don't have transportation options available to them. We've also visited patients in the retirement homes and who are admitted to hospital to continue their care and make sure that sort of their observations and their care is upkept. So that is a really nice part of the rural practice that I find very appealing.
During the first year of medicine, I've learned to take pretty thorough histories in the general areas of the body, and also to do patient examinations, mainly in the areas of cardiovascular, respiratory, renal, haematology. So it was great to put them into practice when I was down there in Streaky Bay. Dr. Oswald always encouraged us to at least have a chat with the patients, to find out what was wrong with them, and then also to talk alongside him what the patient's concerns were. And then he also encouraged me to get involved. He taught us to take blood. A bit daunting at first to put the first needle in, but he guided me, and I really enjoyed the challenge, finding the vein and then keeping the patients calm and knowing that you were doing a good job. The other things that he got me involved were doing needles for different patients. I learned to do immunisations for small children and needles for other patients that came in to the practice.
Well, every day we sort of have a debriefing, and also at the end of the day, and we also start the day with a few plans for the day. And generally she tells me there's a few interesting cases that might interest you and you would gain a lot from. So she ushers me into her consults then, and lets me practice a few of my clinical skills and also my history taking skills if it's a particularly interesting case. But other times she wants me to integrate with the community, so she'll ask me what I've been doing with the nurse, what I if I socialised with members of the community, an auntie or an uncle. She'll ask me how they were, how they responded to me, because she finds it important for me to not just learn the medical aspect but also integrate with the community.